Our thoughts are with the families who've lost loved ones, and we're also thinking and praying for the people who were injured in this attack, including our police officers. So for an update on their condition, I first would like to welcome Dr. Jason Smith, Chief Medical Officer at U of L Health. Dr. Smith.
Thank you, Mayor. So from U of L Health and U of L Hospital, I want to send my prayers and thoughts out to all the families that were affected yesterday, both those we treated and unfortunately those we did not. An update from us, we still have 4 patients in the hospital. 2 remain in the ICU. Officer Wilkes still remains in critical condition, but we have been able to upgrade our other patient in the ICU to stable condition. The other 2 remain in the hospital being treated for non-life-threatening injuries. I want to thank my team, again, the emergency department, physicians and nurses, my trauma team at U of L Health, and all those that supported us yesterday. I also want to send a thank you to the American Red Cross. We used 170 units of blood yesterday to treat these victims, which far outstrips our hospital capacity, and their ability to get us that blood to save those lives helped save those lives. So I want to thank them for that. I won't get into too many specifics about the patients we're currently caring for. We did operate on 3 of them yesterday that required emergency operations. My team were absolute professionals. We trained for this. It's very difficult to be able to process what's going on during that time. And so the training that we do with our emergency department nurses and physicians, our surgical services, our trauma teams, the blood bank, all of that makes a huge difference in being able to save those lives because we have to act quickly. But I'll be honest, caring for 3 shooting victims, plus the other that came in, is not an infrequent day for us. And the events surrounding this made this obviously much more difficult. But to be honest with you, we barely had to adjust our operating room schedule to be able to do this. That's how frequent we are having to deal with gun violence in our community. I'll tell you personally, I'm weary. I've been in Louisville for 15 years, all of it at University Hospital. For 15 years, I've cared for victims of violence and gunshot wounds. And people say I'm tired, but I'll be answered. It's more than tired. I'm weary. There's only so many times you can walk into a room and tell someone they're not coming home tomorrow. And it just breaks your heart. When you hear someone screaming, "Mommy," or "Daddy," it just becomes too hard day in and day out to be able to do that. Now, my team is fantastic. They're absolute professionals and they're wonderful. But sooner or later, it catches up to everybody. You just can't keep doing what we're doing because you just can't keep seeing these lives lost. You can't keep seeing all the people with these horrific injuries coming through the door without doing something to try and help them. And I don't know what the answers are. I'm a doctor. I don't know what the answers are. But to everyone who helps make policy, both at state, city, federal, I would simply ask you to do something. Because doing nothing, which is what we've been doing, is not working. We have to do something because this is just getting out of hand across our city and across this great nation of ours. Sorry.
No.
Yeah, he's still in the ICU. He's still sedated. And I apologize. I am not going to release any other information for the patients that we're still taking care of.
Still in critical, still, you said yesterday the next 24 hours are going to be very intense. Is that still the same stance today?
Yes, so he's still in critical condition in our ICU. He's being treated by our neurosurgery team, being treated by our trauma team and our anesthesia teams, and is still undergoing a lot of care at bedside.
And good news, we had another patient released. I know we talk a lot about the hurt to see these people receive trauma care, but another person was able to leave and walk out of the hospital. How does that feel to see the good part of this today?
Yeah, so I mean, the answer is that, today we had 4, we may have 3. The ones that are doing well are doing well. And I think, the work that we do with the physicians and the nurses at the hospital is just, it's unbelievable sometimes the people that we're able to save these days. We have partners like the Red Cross that can get us, 170 units of blood in a 8-hour period of time. It's just the coordination of the city, of the healthcare system, and of the hospital is outstanding to be able to say that those patients are going home.